Today we're going to talk about supportive second victims. What is a second victim? The second victim phenomenon describes a healthcare provider who is involved in an unanticipated negative patient outcome that damages their well-being. Almost 50% of healthcare professionals will experience symptoms of being a second victim. 65% of second victims deal with the aftermath after an adverse event alone. The Swiss cheese model. Despite error prevention strategies in a healthcare setting, opportunities for errors will always be present. Unexpected and unintentional errors will always be a part of healthcare from human fallibility. Healthcare workers are susceptible due to work-related fatigue, errors in judgment, oversights, and the common expectation for perfection. Hi, my name is Dennis. I perform anesthesia at the local medical center. Never had something like this happen before. The other day I was in a surgery, routine procedure, that ended with a catastrophic event, and the patient is now in the ICU in very critical condition. I was shaking, trying to understand what I did wrong, but I could not figure it out. I lay in bed at night, unable to sleep, trying to think through it all.
Hi, my name is Wendy. I'm a nurse. The other day I was super busy. I decided not to scan my medications before each patient, thinking I could remember them all. I didn't realize until after that I had accidentally given the wrong medications to two of my patients. Luckily, nothing drastic happened to either of them, but now it is constantly going through my head on what to do. I cannot think straight and I'm mad at myself.
Hi, my name is Mark. I'm a radiologist. My job is to interpret findings on patients' medical imaging such as x-rays, CT scans, and MRIs. A while back, a patient came into the ER complaining of a bad headache. CT scan was completed and I misread it as negative and missed the evolving bleed. The patient deteriorated and family decided to withdraw care. I have never forgiven myself. Adverse events can affect any healthcare provider, including but not limited to anesthesia providers, nurses, pharmacists, physicians, dietitians, technicians, therapists, and healthcare trainees. As healthcare providers, we may feel our emotions are invincible and traumatic events are a part of the job. But we are all human and traumatic events can affect everyone. Side effects of the second victim phenomenon include post-traumatic stress disorder, anxiety, anger towards oneself, troubling memories, nightmares, fear of making another error, burnout, depression, and may lead to suicide. Barriers seeking support include possible litigation, uncertainty about the error, fear of loss of job and licensure, and confidentiality often limits the disclosure of adverse events. Dysfunctional ways of coping include solace in alcohol and drug abuse, self-blame, denial, and avoidance. What happens when a healthcare provider fails to seek support? They may damage the healthcare organization's reputation, subsequently creating a third victim. The provider may also second-guess their clinical skills and knowledge base in the future, potentially harming more patients, creating a fourth victim. Now let's take a look at the recovery trajectory. Remember Mark? Without support, he decided to leave the profession and get an office job out of fear for making another mistake. Remember Dennis? He's only surviving with minimal to no support. He lacks enjoyment from the job and lives with regret. Remember Wendy? She got the proper support and is now thriving in her position as a nurse. How to destigmatize reaching out for help. Open disclosure policies need to be created within hospitals, including the 5 human rights of second victims, including treatment, respect, understanding and compassion, supportive care, and transparency and opportunities to contribute to their learning. Recommendations for practice include creation of a peer support program that utilizes hospital clergy, psychiatric department, employee assistance programs, holistic certified nurses, and volunteers. Organizations need to create what is called just culture. The common culture is to blame providers and punish them for errors due to systematic causes, but does not prevent repetition of the error nor address the root cause. Just culture is balancing accountability with systematic defects over which healthcare providers have no control and instead focuses on root causes to prevent reoccurrence. Code Lavender. Code Lavender has been established and initiated at the Cleveland Clinic. It is a crisis intervention tool used to support any person within the hospital after a stressful event has occurred. Code Lavender has been used when challenging situations threaten unit stability, personal mental health, and professional functioning. Code Lavender team consists of spiritual care staff, holistic nurses, hospital-based support services, such as employee assistance, music and art therapy, and volunteers. The goals of Code Lavender are purposeful physical presence, support, debriefing and follow-up, prayer, and professional growth. Here are a couple options to speak to someone anonymously. In the event that you urgently need to speak to someone, the Substance Abuse and Mental Health Services Hotline and the National Suicide Prevention Lifeline are available 24 hours a day and 7 days a week.